Hi, Dr. Dinesh Thakur here again. In the last video, I told you that we'll be discussing something about the mask, but unfortunately, today a new development has happened, and till yesterday we were having only COVID-19 and black fungus to deal with, but today a new entrant has entered into the field, which is called the white fungus. I'm sure you must have heard of it in the news. So today we'll discuss about the what is a white fungus, uh, and how you can prevent it or treat it. So white fungus, it's a layman term for Candida albicans. Candida albicans is again an opportunistic fungal infection. It usually occurs in people who are immunologically weak. As we discussed in the previous video of the black fungus, the cause of white fungus is very much similar to the causes of the black fungus. The difference between white fungus and black fungus is that the black fungus is only localized to the sinus, nose, or the maxilla or the facial regions. But white fungus is not localized, it is a systemic infection. So that means that the Candida albicans or the white fungus can not only infect the lungs, it can infect the brain, it can infect the genital organs, it can infect the skin, it can infect your mucous membranes, and possibly everything that you can imagine. So that is why it is being said that it is more dangerous than the black fungus. Okay, so the treatment is it is easier as compared to the black fungus because Candida albicans is sensitive to many antifungals like the fungins are there, the amphotericin B, which is used for treatment of black fungus, is there, fluconazole is there. So it is sensitive to many antifungals. Just the duration of treatment is far longer than the usual treatment of bacterial or viral infections. Rather, the treatment has to be extended 2 weeks extra after the symptoms of white fungus have subsided. It has to go on for 2 more weeks after that. So it is a very prolonged treatment, and obviously cost involved also goes up. So today we'll discuss what are the causes of these fungal infections which are coming up every day in COVID patients and or in the COVID era. So for a very simple method of remembering these things, there are four U's to it. Four U's to it. So first use is unregulated medicine use. Now what is happening is a person gets COVID-19. He is mildly symptomatic or is moderately symptomatic. He stays home. He starts his own medication. Then there is family pressure. For example, recently one of my patients called me up that his forcing him to take Fabiflu or these steroids, Medrol and all, and he was taking those medicines without realizing that all those medicines were actually lowering his immunity. So that is family pressure. Then there is overzealous treatment by the authorized and the unauthorized medical professionals. Obviously, unauthorized medical professionals don't know what the complication of any drug is. They just know that this particular drug can do this benefit, but they do not know what the side effects can be. But since uh, medicine is not very regulated in our country, so such kind of practices are in prevalence. The authorized medical professionals or the usual trained physicians, obviously, they are also using over medication. So, like prescribing high dose steroids for people who are at home isolating just because they have mild to moderate symptoms. They are being prescribed as high dose steroids for like 5, 10 days, even 15 days. Then antibiotics are being prescribed. First, they'll start with doxycycline, then ivermectin and azithromycin, then cephalosporins, then even people are prescribing Septran. So, which has no logic to it in a mild to moderate case. And there is a media hype which is also causing unregulated medicine use. Every day you listen to the news and they claim a new drug is in the market. Ivermectin was being flashed on the TV a few days back, then doxycycline, again the same thing is happening. Media influences you and you try to take any possible medicine which is being told by the reporters without even uh, getting a scientific opinion to it. Then there is anxiety. Everyone wants to get fine quickly. They will ask the chemist, please give me the best possible medicine so that I can recover quickly. So again, the same thing happens: high dose steroids, antibiotics, antivirals, then antihelminthics like ivermectin. Everything is given as a lump sum treatment without even understanding if it is required or not. Even respules of steroids for nebulization is being given for mild, moderate cases, which are not usually required. So there is misuse, abuse, overuse of medicines. This all leads to reducing the immunity of the patient, and fungus gets the chance to grow in a body where it could not have grown otherwise. So the first and the foremost thing which we discuss is the overuse of medicine. So do not just eat medicine because someone has told you to eat them. Consult a physician and stay informed. That is utmost important. So the second U in the causes of these fungal infections in COVID patient is unhygienic oxygen. So recently you must have heard that there has been a huge demand for oxygen in patients of COVID-19. So there has been a huge hoarding of oxygen cylinders, oxygen concentrators, and many people have just bought oxygen concentrator as a prophylaxis that if God forbid some requirement of oxygen happens, and since the oxygen cylinder is not available, that oxygen concentrator might be your life savior. So nothing wrong in that, but you need to know how to use that oxygen concentrator or the oxygen cylinder which you have procured. What usually happens is there is a thing as known as a humidifier in any oxygen circuit. You must have seen that bottle of water which through which the bubbles are coming out and then being fed to the mask. So that is a humidifier. So usually that humidifier contains sterile water or normal saline, which is again sterile. But since not everyone knows this, and everyone is not informed by the person who has supplied the oxygen cylinder or the concentrator, that such kind of a thing has to be taken care of. People are using tap water or mineral water in that humidifier. So tap water might have molds or spores of the fungus, which can be transmitted to the patient when he inhales through that humidifier, which is containing the tap water or the mineral water. Then the other reason for unhygienic oxygen is dirty oxygen cylinders. Unfortunately, during these times of oxygen crisis, a few cases have come to light that many people were selling cylinders which were not ideally meant for oxygen cylinder. A few people were even selling fire extinguishers with an oxygen dispenser attached to it, which is outright dangerous. And since it is not clean, it might be contaminated with these fungal spores, and anyone who is taking oxygen through that cylinder might get infected. Third thing is the hospital. Even in the hospital setting, these fungal infections can occur. There are many reasons to it. There is lack of staff, lack of trained staff, and since the turnover of patient is so large that there is the infection control protocols might not be followed by the staff which is taking care of the patient. So what can be done to avoid all these things which lead to unhygienic oxygen? First thing is that even let's talk about that oxygen concentrator which you have at home or the oxygen cylinder which you have at home. The humidifier part and its components have to be washed once a week in an antiseptic liquid, and it has to be cleaned with clean water, and then it has to be dried and then used. Without even drying or without even using antiseptic solution, it is not supposed to be used beyond 1 week. And you have to use distilled water or normal saline or sterile water in that humidifier, not tap water, not mineral water. So any RO water, tap water, mineral water is totally wrong in that humidifier. Use sterile water or a normal saline In hospital settings, in between patient, the humidifier components have to be sterilized, as I told you, with antiseptic solution and then dried in the air, so that the cross contamination between people do not happen, and the spores which are present in the oxygen or in the humidifier, they do not get transmitted to the other person. So the third U in the cause of fungal infections COVID is uncontrolled diabetes mellitus. As you all know, our country is the leading country in the world with the largest number of diabetics in the world, largest number of young diabetics in the world. So this particular thing has been the main reason of these fungal infections being diagnosed in India. So what happens is that mostly people, either they stop taking their medications or they are not able to monitor their sugar levels, and diabetes itself causes suppressed immune system. So anyone who is having uncontrolled diabetes mellitus with with a suppressed immune system, and they are on steroids or antibiotics, are highly predisposed to develop fungal infections. Also, there is lack of proper monitoring of diabetic statuses, just because either people are on home treatment and they don't have the right equipment to monitor the sugar levels, or they are in the hospital, but still because the staff is overburdened, the monitoring thing is not being taken care of. So it's a deadly concoction of diabetes mellitus, high dose steroids, which leads to the whole burden of fungal infection, which is either black fungus or a white fungus, which are leading to the high morbidity in patients. So as I told yesterday, our target of blood sugar has to be less than 125 grams per deciliter. So it should not go beyond 125. And the HbA1c level has to be less than 6.5. That is the target blood sugar levels which are to be maintained, so that the patient is considered to be a controlled diabetic. The last U in the causes of fungal infections in COVID is unhygienic living conditions. Unfortunately, a large portion of Indian population is living below poverty line, and they are living in unhygienic conditions. All these fungal spores, be it black fungus or white fungus, they live in soil and contaminated water, and that is how people get in touch with all these spores of fungus. Once they are inside the body and then they get the right environment of reduced immunity, they are bound to increase and cause complications. Black fungus, we discussed yesterday that it causes localized complications. This white fungus causes generalized body complication. It can cause fungal pneumonia, which is very much similar to COVID pneumonia. It can cause pharyngeal candidiasis. It can lead to brain candidiasis. It can lead to your genital organs being affected by candidiasis, which is the white fungus. So it is utmost important that all these four U's, as I told you, the unregulated medicine use, the unhygienic oxygen, the uncontrolled diabetes mellitus, and unhygienic living conditions, have to be taken care of. If there is a person who is exposed to all these four U's or any one of these U's during this COVID pandemic, has to be on alert for fungal infections. So I hope this video has helped you. Most probably we'll come tomorrow with the video of the mask which we promised for today. So till then, take care. Bye.